Some changes are coming to federal student loans next year. The new federal budget puts limits on borrowing for medical students. Leaders at the University of New England, home of Maine's only medical school, are worried about the impact this will have on students. News Center Maine's Katie Delaney has the details.
The new borrowing cap for medical students is $50,000 a year with a lifetime limit of $200,000. Now, this might sound like a pretty high limit, but medical students here at the University of New England borrow an average of $300,000 to pay for their education. Previously, medical students could cover the whole cost of tuition with federal loans. Now, UNE leaders are worried about how this gap will impact students and the medical industry here in Maine. UNE's president, James Herbert, says this new federal loan limit could cause less students, particularly low-income students, to go into medicine. That's largely because the borrowing cap will force students to take out more private loans, which are harder to pay off. He also fears that this will lead students to seek out higher-paying jobs in big cities rather than staying here in Maine.
We don't need more doctors in Boston. We need more doctors in Caribou. And so I want to be able to give students the opportunity to go, even though those jobs pay less in rural areas of Maine. That's where we need the physicians. And I worry that this legislation is going to make it harder for our graduates to go into those rural settings.
Going forward, Herbert says that UNE has been talking with some groups about how to get students loans with more favorable terms than private loans to hopefully help fill this gap. In Portland, Katie Delaney, News Center, Maine.